Antihypertensive drugs are the inhibitors of angiotensin. Now, there are three chemical compounds in the body that includes renin, angiotensin, and aldosterone. These three compounds, they play a very major role in the essential hypertension, and approximately 20% of the patients with essential hypertension, they will have inappropriately high levels of renin and angiotensin in their blood. Renin is actually released from the kidney cortex, and then it initiates a cascade of events that leads to vasoconstriction and a retention of sodium and water, which causes an increase in the blood pressure. And the release of renin from the kidney, it is mediated by decreased renal arterial pressure, sympathetic neural stimulation, or reduced sodium delivery, or if there is an increase in sodium concentration at the distal renal tubule. So all these effects, they causes the kidneys to produce an increased secretion of renin. We have two major classes in this group. Number one is the ACE inhibitors, and number two is the angiotensin receptor blockers. We'll discuss the mechanism by this with the help of this diagram. You can see that these are two pathways that are happening simultaneously, and this is the renin, which initiates the cascade of events. It converts the angiotensinogen into angiotensin 1, which is an inactive compound, and this angiotensin is converted into angiotensin 2 with the help of an enzyme ACE, which is present in the endothelium. Now, this angiotensin 2 is the active compound which causes or which mediates the vasoconstriction or increases the secretion of aldosterone. The vasoconstriction will increase the peripheral vascular resistance and cause an increase in the blood pressure, and the aldosterone, it will cause an increase in the sodium and water retention, and it will increase the blood pressure. So the net effect of the angiotensin 2 is an increase in the blood pressure. So the first class, which is the angiotensin receptor blockers, they actually antagonizes the effect at the receptor level of this. It will not let the angiotensin 2 bind with its receptors, and it will prevent the whole cascade of events. And the second class of drug, which is ACE inhibitors, they act here. They inhibit this enzyme, and then they prevent the whole cascade of events, and the net result is decreased in the blood pressure. This is how these drugs, they play a role in the management of blood pressure. A similar or a parallel pathway that is occurring along with it is bradykinin mediated. Bradykinin is a very powerful vasodilator. As we can see that it causes vasodilation, and the peripheral vascular resistance is decreased, and a decrease in blood pressure is seen with this chemical compound. So we have already discussed the mechanism of action of ACE inhibitors. They causes a decrease in the levels of angiotensin 2 by inhibit the conversion of angiotensin 1 into angiotensin 2. There is an increase in the level of canins into there is an increase in the level of bradykinin, inactive metabolite. The uses of ACE inhibitors are in hypertension, in diabetes, and in heart failure. The toxicity of ACE inhibitors includes cough, which is very troublesome with the use of ACE inhibitors, hyperkalemia, and angioedema. So all these effects, they are often seen with the use of ACE inhibitors. The second class is the angiotensin receptor blockers. These drugs, they comparatively inhibit the angiotensin 2 at its receptor, that it does not prevent the conversion of angiotensin 1 into 2. However, it prevents the binding of angiotensin 2 with its receptor, thereby preventing all the cascade of events that induce the vasoconstriction and the aldosterone production. It has a lower incidence of cough. Therefore, if the patient experiences cough with ACE inhibitors, we switch them to ARBs. There is also a lower incidence of hyperkalemia with the use of ARBs. They are equally effective, but they come with a lower incidence of cough and hyperkalemia as compared to the ACE inhibitors. There is another compound which is called as renin inhibitor, and the name of this drug is aliskiren. It directly it does not let the renin act on its substrate, which is angiotensinogen. So it prevents the conversion of angiotensinogen to angiotensin 1, as this effect is mediated by the renin. So this compound or this drug, it prevents this action. Thereby, it is also used in the treatment of hypertension. The toxicity of this drug is diarrhea and headache. All these drugs, they are contraindicated in pregnancy. The renin inhibitors, the ACE inhibitors, and the ARBs, they are all of these drugs, they are never used in the pregnancy because they causes the fetal renal failure.